When you become a Rogers volunteer, it's always an opportunity for everybody to come together and try different things that they've never been able to do before.
What I've learned here is different skills that I thought I would never even be interested in learning.
By being here at Rogers, I can learn all these different things that will help me be stronger.
Working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team.
They're people from our community, so they know and they have a heart for our community to step outside of our comfort zone and do more.
Don't be afraid, because this is where you're going to gain the most valuable experience that you can use in your future.
I encourage everybody to be a volunteer at Rogers TV because not only do you grow professionally, you grow personally as well.
This is Rogers TV, New Brunswick.
It was my daughter's birthday. She was blowing out the candles on her cake when we heard coming from the TV. So we stopped and listened, and it helped us get to safety. That's why when I think of my daughter's birthday, because now she gets to keep having them.
This is Rogers TV, Fredericton.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre Blaine Higgs. Speaking on behalf of the province this afternoon are the Chief's Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon. Bonjour. Before I start, I just wanted to bring to light that today is National Caregivers Day. And here in Canada, we have about 5.4 million caregivers. That's a lot of people. And 2 out of 3 of those caregivers are actually providing care or assistance to an older adult. So I just wanted to acknowledge that the important work that caregivers do in New Brunswick and in Canada and recognize them today. Alors, un gros merci pour les gens qui prennent soin des autres et c'est une célébration nationale aujourd'hui. I also wanted to bring to your attention, a psychologist recently reached out to me talking about a service that's offered to frontline staff by the Canadian Psychological Association. So psychologists from across Canada have come together to offer mental health assistance to frontline workers during the COVID-19 crisis. So they put out a press release recently, and we have put the links on our website so that people can access that. And I think it's really, really important at this time. Everybody needs to look after their mental health, but certainly people who are working on the front lines in terms of anxiety and stress and uncertainty right now, I think it would be very, very important to make sure that they have adequate support for mental health issues and also moving forward as things progress during the pandemic. So I think that's a really important support to provide to them right now. So, the COVID-19 pandemic continues to evolve, and it's constantly changing, and to meet this challenge, we must change with it. My advice and direction to New Brunswickers will change over the course of this outbreak because it has to. And I know that's also creating anxiety and stress because we're trying to keep up with an enormous amount of information, and we're trying to provide that information to people as soon as we get it. And the changes that happen in quick succession, sometimes it's hard to absorb and digest. So we want to keep you abreast of all the situations and keep you informed. And whatever new changes happen, we will make sure that we put that information on our website to keep you up to date. So my advice around what we're learning about the virus, again, has to be adjusted, and our strategies have to be adjusted accordingly as well. So today I want to provide more details on 2 significant changes and advice that we are making to meet the COVID-19 challenge: broadening the scope of testing and the wearing of non-medical masks or face coverings in public. And again, this can be confusing. It's new information, and we want to make sure that we answer people's questions around how we can be more consistent in providing that information to you. Aujourd'hui, je tiens à fournir de plus amples renseignements au sujet de 2 importantes modifications que nous apportons à nos conseils concernant la pandémie de la COVID-19. Nous élargissons la portée des tests de dépistage et nous recommandons le port d'un masque non médical en public. Ces modifications pourraient créer de la confusion pour certains et d'autres pourraient se demander si nous manquons d'uniformité. We cannot allow ourselves to think that what worked last week will necessarily work today or next week. It is a form of complacency, and we have to avoid that. So today there are 2 new confirmed cases of COVID-19 in New Brunswick, and this brings the total number of cases to 105. The new cases are as follows. In Zone 3, which is the Fredericton region, an individual between the ages of 10 and 19, and in Zone 7, the Miramichi region, an individual between the ages of 70 and 79. So as today's cases clearly show, COVID-19 can strike any person at any age in any community of our province. And that's why it remains vital that every New Brunswicker stay at home as much as you can. And when you do go out, keep your interactions brief and maintain 6 feet of physical distance between yourself and others. When you do go out in public, especially when you go to places where you may not be able to maintain a space that the virus cannot cross, that's why we're now suggesting the use of non-medical face coverings. So I want to be clear about why this suggestion is being made. And I also want to be clear about how this is one small part of the very important pieces around social distancing and avoiding mass gatherings, et cetera. So it's not to protect you from the virus, it's to protect other people in case you happen to be somebody who is pre-symptomatic or doesn't have symptoms from COVID-19, but actually is infected with COVID-19. So aujourd'hui, j'annonce qu'il y a 2 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick, portant le total à 105 cas pour la province. Les nouveaux cas sont répartis comme suit. Une personne âgée entre 10 et 19 ans dans la zone 3, la région de Fredericton, de New-Brunswick, et une personne âgée entre 70 et 79 ans dans la zone 7, la région de Miramichi. Comme le démontrent les cas que j'annonce aujourd'hui, la COVID-19 peut infecter les personnes de tout âge, n'importe où dans la province. C'est pourquoi il est toujours absolument crucial pour chaque citoyen de New-Brunswick de demeurer à la maison le plus possible. Si vous devez sortir, gardez vos interactions brèves et maintenez-vous à une distance d'au moins 6 pieds des autres. Si vous devez aller en public, surtout à des endroits où il pourrait ne pas être possible de vous maintenir à suffisamment de distance des autres pour empêcher la propagation du virus, nous vous recommandons maintenant de porter un dispositif non médical fait de tissu pour vous couvrir le visage. Je tiens à être très clair que sur la raison pour laquelle nous faisons cette suggestion. Cette mesure ne vous protégera pas contre le virus. Elle vise à protéger les autres personnes que vous pourriez infecter. Even if you have no symptoms, you may have come into contact with the virus and you could unknowingly be spreading it to other people. In this situation, where physical distancing may be difficult, like in grocery shopping, wearing a non-medical facial covering can reduce the chance that your respiratory droplets will come into contact with others, land on food products or other surfaces. And I want to emphasize that people should not procure or use surgical masks. These are urgently needed for our healthcare workers, so we want them to feel safe in their work environment. So please don't use surgical masks that are intended for hospital workers. Any cloth covering that fits snugly over the mouth and nose is effective, and make sure that you wash it after each use and wash your hands before you touch it and after you touch it. Wearing a mask in public is not a must-do. It's an additional action to protect others. So it does not replace physical distancing. It doesn't replace regular hand washing and cleaning frequently contacted surfaces. These practices continue to be more important than wearing a mask in public. Je tiens à souligner que les gens ne doivent pas se procurer ou utiliser des masques chirurgicaux. Les travailleurs de la santé ont incessamment besoin de ces masques pour pouvoir se protéger dans leur milieu de travail. Il n'est pas absolument nécessaire de porter un masque en public. Il s'agit d'une mesure supplémentaire visant à protéger les autres. Cette mesure ne remplace pas le principe de distanciation physique, la consigne de se bien laver les mains régulièrement, ni la directive de nettoyer les surfaces touchées fréquemment. Il est plus important de continuer à respecter ces consignes que de porter un masque en public. This is about protecting others and slowing the spread of the disease. Slowing the spread and progress of COVID-19 is the reason that we are making changes to our testing protocols. So we remain focused on testing the right people at the right time. As we now have confirmed cases of community transmission, where a case cannot be directly traced to an infection which occurred outside New Brunswick, our testing has been adjusted accordingly. So under our new strategy, travel outside of New Brunswick will no longer be the key determinant for referral to testing. So if you experience symptoms of COVID-19, call 811 and follow the specific directions followed by public health. And if you have a family doctor who's providing virtual care, that's another option for you to access testing. Comme nous avons constaté, des cas de transmission communautaire dans la province, c'est-à-dire des cas qui ne sont pas directement liés à une infection contractée à l'extérieur du Nouveau-Brunswick, nous avons modifié notre stratégie de dépistage en conséquence. Dans le cadre de notre nouvelle stratégie, les antécédents de voyage à l'extérieur de la province ne constitueront plus le principal facteur pris en considération pour un renvoi à un test de dépistage. Si vous avez des symptômes de la COVID-19, composez le 811 et suivez les directives précises données par la santé publique. We will continue to prioritize testing for those who protect us and those who are in greatest need of protection. We will also prioritize testing for individuals with health conditions that leave them more vulnerable to the virus, such as those over the age of 60, people with hypertension, cardiovascular disease, chronic respiratory disease, diabetes, and cancer. I know this will be a source of stress and anxiety for many of you in the coming days, but please be assured that the Department of Health, our regional health authorities, and our lab staff will be doing everything they can to minimize delays. Again, the best way to ensure that we can meet this challenge is for everyone to do what they can to avoid contracting or spreading the disease. So, above all else, stay home in your own home. It will save lives. Encore une fois, je vous rappelle à tous que la meilleure façon de nous aider à relever ce défi consiste à prendre toutes les mesures possibles pour ne pas contracter ni propager cette maladie. Le plus important, c'est de rester chez vous le plus possible, dans votre propre maison. Vous aiderez ainsi à sauver des vies. Thank you very much. Merci beaucoup.
Good afternoon. Bonjour. Since this pandemic began, our government has worked quickly to make sure New Brunswickers have the resources they need to make it through this difficult time. This included providing New Brunswick workers emergency income benefit in partnership with the Red Cross. This one-time income benefit of $900 has provided much-needed relief to New Brunswick workers and self-employed people who lost their job due to the state of emergency. L'objectif de la prestation de revenus d'argent de la province a toujours été d'aider les travailleurs avant qu'ils puissent recevoir leur prestation d'assurance emploi et la nouvelle prestation canadienne d'assurance. Nous sommes heureux que tout se déroule comme prévu au niveau fédéral et que les personnes touchées puissent maintenant commencer à recevoir ces prestations. Now that federal benefits are available, we will stop accepting applications for the New Brunswick Workers Emergency Income Benefit on Thursday, April 9th at 8 p.m. All those who have registered by this time will have their applications processed. Since we launched this benefit, 60,000 applicants have registered. To date, we have provided more than $20 million in benefits. The Canadian Red Cross has processed nearly all of those who have met the requirements, and many more will follow. Staff are working 7 days a week to process application and issue payments. They will continue to do so until they have finished reviewing all the applications we received before the deadline on Thursday. As we previously announced, our government is also providing assistance to small, medium, and large businesses that have been impacted by the pandemic. We acted quickly to make up to $50 million available in immediate assistance. As of today, small business owners impacted by the pandemic can apply for working capital loans of up to $100,000 through the NB Small Business Emergency Working Capital Program. The loans are being administered by the Community Business Development Corporation. We are also making working capital loans above $100,000 up to a maximum of $1 million available through Opportunities New Brunswick. Businesses can apply directly to Opportunities New Brunswick by contacting the business navigators for this support. It is clear the impact of this pandemic on our society will be long-lasting. It is not a short-term situation. It is also clear that there will be an end to this pandemic, and we will come out of it. We will have an overall recovery plan, and we will seek your thoughts to get our communities, our businesses, our employers, our entire society going again. I believe this will require unprecedented focus, a level of collaboration, and a level of cohesion that I know we're capable of achieving and that we have demonstrated thus far. I can tell you that we will be there to do our part for New Brunswick and our residents. I know many people have concerns about tests and personal protective equipment. Je sais que plusieurs personnes ont des préoccupations concernant les tests et l'équipe de protection du personnel. Je veux vous assurer que nous allons continuer de travailler avec le gouvernement fédéral et les autres provinces pour nous assurer d'avoir les produits dont nous avons besoin, ici, au Nouveau-Brunswick. Je reste en contact avec le Premier ministre du Canada et le Premier ministre des autres provinces et territoires. We need to function as a country. We need to send supplies where they are most needed. We will share what we can, and we will know it will come back to us when we have our needs. As expected, we received more than 5,000 test kits from the federal government just yesterday. We also expect to receive shipments of personal protective equipment and N95 masks in the days ahead to continue to keep our essential workers safe. As a country, we have never been more united. Masks and ventilators are being produced in factories in Ontario now. We have companies in New Brunswick producing hand sanitizers. Nova Scotia is producing surgical gowns. Now, like never before, we are acting as one. Our country has banded together to pull through this pandemic. Since emergency order was put in place, I've been very impressed by many organizations that have found innovative ways to continue their operations. Churches are one example. Au Nouveau-Brunswick, plusieurs lieux de culte ont commencé à présenter leur cérémonie en direct sur le web. Je sais que la participation à des cérémonies religieuses peut apporter beaucoup de confort, en particulier durant cette période difficile. I don't want New Brunswickers to miss out on the sense of community that places worship can provide. But right now, we have to put safety above everything else. With Easter approaching this weekend, it is necessary for spiritual leaders to continue to explore virtual ways to celebrate their faith and not hold traditional services. Celebrating Easter is going to look different than usual for all of us this year. As Dr. Russell said yesterday, this is not a time to look for loopholes. That means no public gatherings are allowed. Holding church services or mass gatherings, even outside, will not be permitted. We will not be able to enjoy a holiday dinner with our extended family. And it was only yesterday that my mother and I were talking about this weekend, and she said, "Are you coming home for Easter dinner?" And I said, "Absolutely not." And we discussed the reasons why, and she was very understanding that this would not be an Easter that we should celebrate together. And I must say, with my mother being 99, it's tough not to be at any gathering at all. And I know many of you are experiencing that very same emotion with either loved ones in a hospital or very sick for other reasons, and you're not able to visit or comfort them at this time. But we must hold true to what we know is necessary, because if we want them to be there for future visits, we must protect their safety now. Our children cannot participate in the neighborhood Easter egg hunts like they may have in past Easters. I know this isn't easy for any of us, but I want all of you to still be here next year to celebrate Easter. Je vous demande d'acheter à l'avance les produits dont vous avez besoin, ou bien d'attendre la semaine prochaine pour acheter vos produits essentiels. Je remercie tout le travail des commerces essentiels qui continuent de fournir des services et des produits importants aux gens de Nouveau-Brunswick. Lorsque nous devons quitter la maison pour acheter des produits comme l'épicerie, rappelez-vous de choisir une seule personne de votre maison qui sera le consommateur désigné lorsque c'est possible. It's very important, and I know people want to go for a family outing, but going to the grocery store with your whole family is not a necessity that you should be doing. You should go to the grocery store, one person, to get the groceries needed. It's not the time for a gathering to travel in numbers where it's unnecessary. Stay at least 2 meters away from others. Continue to wash your hands regularly. We all have a role to play, not only to protect ourselves, but to protect others. And at this point in time, I'm really appreciative of what I've seen so far. Together, we can make this through. Together, we can minimize the impact on others and ourselves. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans les langues de votre choix. Chaque journaliste aura une question. We will now proceed to questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Laura Brown, CTV News.
Hi there. I'm wondering, either one of you can tell me where or what is the status of the ventilators that I believe you had ordered a couple of weeks ago. It has been mentioned that we had 161 ventilators, I believe, in the province, and you were ordering quite a few more. What's the status of that delivery?
At this point, I don't know. We have about 150. That was going to take us to 250. I don't know that the order has arrived. But at this stage as well, I think we only have 2 individuals that are in the hospital and possibly on ventilators. So we're certainly well supplied at this stage for the conditions that we are experiencing. And we expect that order to arrive long before we would need it.
Laura, do you have a follow-up?
I do, just very quickly. Yesterday there was 3 people in the ICU and 7 people in hospital. What's the status of those people at this point, and is that increased or decreased at this point?
So in terms of the status of people in the hospital, before I answer that question, Laura, could I just ask everybody in New Brunswick to keep those people in your thoughts and prayers, because all of the people who are hospitalized right now, their families are quite worried about them, and they could probably use some thoughts and prayers right now. So what I know about people who are hospitalized with COVID-19, we originally had 10 that were hospitalized. 3 people have been discharged and 7 remain in hospital, and 4 are in the intensive care unit.
Thank you, Laura. Elizabeth Fraser, CBC.
Hi there, my question is for the Premier. You told us last night that there were 295,000 masks from the United States that were on hold because of President Donald Trump's order for 3M to prioritize orders of N95 masks for American use. But 3M since announced it struck a deal with the U.S. that will allow it to export the masks to Canada as well. What does that mean for the New Brunswick shipment?
Well, it was good news to hear that, and although it hasn't been confirmed to me yet, from that I would take that we will receive them as originally planned. But even more so going forward, judging from what you've just quoted and what I saw as well, it would appear that we would be able to achieve further deliveries as required. But I think something I'd like to point out that I mentioned in my address this morning, we are looking at the use and the requirements across the country. And I say we're operating more like one nation than I've ever experienced before. We're going to look at where all equipment is required when needed, because we know the struggles that are happening in Quebec. We know what's happening in Ontario and BC, and I guess while we expect those masks to be delivered here, we will get what we need when we need it. So I'm feeling very confident in how we're working through the system to protect all Canadians.
Thank you, Premier. Do you have a follow-up, Elizabeth?
Yes, I have another question for Dr. Russell, and it's similar to Laura's question, but we have heard of 3 ICU patients that are on ventilators in St. John, Fredericton, and Moncton. Can you just be more specific about those patients and how they're doing?
So we have 2 people in ICU right now, and I don't want to comment more specifically on where they are and whether they're on ventilators or not, but I think what we know about people who are hospitalized and needing ICU care, they obviously have more severe symptoms. And so again, as I'm answering these questions, I do want you and New Brunswickers to keep that in mind. sorry, we have three people in ICU, and I don't want to talk about the specifics about that, but again, I think we all need to keep their families and the patients themselves in our thoughts right now, because it is obviously, if they're getting that level of care, their symptoms are severe.
Thank you, Doctor. Thank you, Elizabeth. Vicky Hogarth from Charlotte County TV.
Thanks, Bruce. My question is for Premier Higgs. Premier, tourist communities like St. Andrews are still experiencing a concerning amount of traffic from visitors from around the province looking to walk the beaches, streets, hike the trails. Has there been any discussion about extending emergency measures to go beyond just provincial border checkpoints to include municipal checkpoints to reroute unnecessary traffic? And could the Department of Public Safety officers help municipalities who are affected by excessive non-essential travel?
So, yes, there has been discussion about that, been discussion about the reality in different communities and what that might look like. The ability for us to actually police it in a way that is effective. You know, we've asked every community to close their provincial parks or close their municipal parks so that they wouldn't be inviting for people to show up in mass groups. You know, I think throughout the province we're going to find people that are out for a walk and hopefully doing so and meeting all the requirements and guidelines, including the most recent discussion about the safe use of masks. We'll work as municipalities on this, and we've had questions, I would say, in relation to Grand Manan, in relation to St. Andrews, in relation to the peninsula, because it's basically, where do you end this? Where do you stop? We're guarding our provincial borders. Do we have the ability, and is it the necessity to put that same sort of connection around communities? Because that will be very difficult, extremely difficult to enforce. And I think it is a discussion, and it will be a topic over the next day or two of whether it is possible to make it an effective restriction, or can we heighten the public, I guess, view and just don't be congregating in mass.
Thank you, Premier. Vicky, do you have a quick follow-up?
I do. It's for Dr. Russell. Thank you. Canada is beginning a clinical trial of an experimental COVID-19 treatment that injects COVID-19 patients with plasma from patients who've recovered. The study involves 40 different hospitals across the country. Is New Brunswick involved in any capacity in this study?
I've heard about that study, but I haven't been made aware that any New Brunswick hospitals are involved.
Thank you, Vicky. Kevin Bissick, Canadian Press.
Yes, question for Dr. Russell. Dr. Russell, a little bit more on the supply of PPEs. I wonder if you could update us on what your supply is of PPEs at this point, particularly the number of masks, and how long that will last us.
I don't have the exact numbers, but I can get those. We do have our original stockpile. We have EMO, who is now also having a stockpile as well, and we have ways to distribute that to healthcare providers in the community. I am aware that we have a good supply, and I know that the discussions that we've had with all of our partners from the RHAs, EMP, A&B, the unions, etc., all of our partners are on board with understanding that, you know, we have stockpiles, we have shipments coming in, and it's not a finite, it's not an infinite number of supplies. So we will keep track over the course of the pandemic to make sure that we have enough, and we're all working hard together to make sure that that's happening. And my understanding is that the Premier will be talking about that on the next federal call.
Kevin, do you have a follow-up?
Yeah, just a quick question. I know I've seen reports of this elsewhere. Are you hearing any reports of people improperly disposing of masks and gloves?
You mean members of the general public? Or do you mean healthcare workers?
Coming out of grocery stores and just tossing their gloves aside or masks aside?
I'm sure it possibly could be happening. I know that if people are wearing those items, that they should obviously try to dispose of them properly. So if it is happening, then I would I would offer the advice that they should dispose of them properly. And I guess there's some photos on social media, I guess, around that. So I would encourage the public to dispose of them properly in garbage cans.
Thank you, Kevin. Michel Corriveau, Radio-Canada, s'il vous plaît.
Oui, une question pour Dr. Russell. Vous dites souvent l'importance de bien communiquer et d'éviter les rumeurs. J'aimerais savoir combien il y a de cas à l'heure actuelle chez le personnel médical au Nouveau-Brunswick, sans donner nécessairement les hôpitaux précis, là, combien il y a de cas?
Il y a 15 cas.
Suivi, s'il vous plaît. Michel, as-tu un suivi?
Oui, j'ai une question pour M. Higgs, toujours sur l'importance de communiquer. Vous savez, M. Higgs, Premier ministre, ces conférences de presse sont écoutées par des milliers de personnes. Or, ça se fait surtout en anglais. Alors, on se demande pourquoi ne pas demander à un ministre bilingue de participer pour que les gens puissent entendre des réponses dans leur langue et donc par le biais de traducteurs.
Well, I guess in my case, Michelle, it's a benefit of being in a bilingual province. You know, we're allowed to obviously ask questions in our own language, and we're allowed to respond to questions in our own language, and that's the nature of our province, which I cherish very much. I guess certainly as a unilingual New Brunswicker. So I believe, you know, in a case we have full interpretation capabilities here. I have a translation device here, so I can understand your question as you ask it in French, and I believe and I do certainly part of my presentation in French, and certainly we've been supplying information all over this province in both official languages, and I think we've been working very hard to do that, and I think most of Brunswickers appreciate that, and I'm thankful to be able to do it.
Merci, Michel. Dr. Russell veut revenir au podium pour une clarification.
Oui, je voulais juste clarifier que les cas que j'ai annoncé qu'il y en avait 15 dans les travailleurs de santé, c'était tous des cas qui étaient reliés au voyage ou quelqu'un qui était un contact proche de quelqu'un qui avait voyagé. Puis je voulais donner la définition de ce qu'on veut dire quand on dit un travailleur de santé. Puis ça veut dire, c'est des médecins, des infirmières, des gens qui travaillent à l'urgence, des dentistes, des étudiants, des techniciens de laboratoire, des techniciens à haute place dans le système de santé, des physiothérapeutes, des pharmacistes et des bénévoles et aussi des travailleurs administratifs.
Merci. Michel, non, excusez, Mathieu Roy-Como, l'Acadie Nouvelle.
Bonjour, ma question est pour Dr. Russell. Vous avez annoncé qu'on va élargir les critères pour les tests de dépistage. Vous avez déjà dit qu'on a la capacité d'en analyser 1000 par jour. Je me demandais quel était l'objectif du nombre de tests à réaliser par jour en ce moment, maintenant que les critères seront élargis. Dans un scénario idéal, on en ferait combien par jour?
Tu voulais savoir si on est préparé à augmenter à 1000 par jour?
Pardon?
Tu voulais savoir si on est prêt à augmenter à 1000 tests par jour?
Je veux savoir si, idéalement, vous en feriez 1000 par jour. C'est quoi votre objectif de tests par jour maintenant qu'on a élargi les critères pour faire des tests?
Hier, on avait fait 596 tests. Alors, on sait que les possibilités pour augmenter le système pour faire plus de tests, c'est là, la capacité est là. Pour moi, mon objectif, c'est toujours le même. Donner les tests à les gens que c'est en anglais, the appropriate. Alors, le meilleur test pour la meilleure personne à la meilleur temps. Alors, ça, c'est le plan, la stratégie nationale qui nous dirige sur les nombres de cas et les types le sorte de transmission qu'on voit au Nouveau-Brunswick. Alors, c'est toujours pour moi, le succès, c'est les gens qui devraient être testés seront testés.
Merci. Monsieur Como, as-tu un suivi?
Oui, s'il vous plaît, sur le même sujet. On sait maintenant que les gens peuvent transmettre le virus même s'ils n'ont pas de symptômes. Est-ce que c'est possible qu'à un moment donné, on décide de tester tout le monde, même ceux qui n'ont pas de symptômes? Je comprends qu'on n'est pas là aujourd'hui, mais est-ce qu'on pourrait en arriver là?
Alors, pour maintenant, c'est pas les directives qu'on reçoit de l'Agence de santé publique du Canada, c'est pas des directions qu'on reçoit au niveau fédéral, national. Et certainement, il y a des endroits des autres provinces où ils ne testent pas des gens qui ont des symptômes qui sont moins sévères. Alors, les directives, c'est si vous avez des symptômes, restez à la maison pendant 14 jours et ils ne se font pas nécessairement, ils ne sont pas nécessairement testés, mais ils seront comptés comme un cas quand même. Alors, les directives à ce moment-ci, ça ne serait pas de tester les gens qui n'ont pas des symptômes, mais en avançant, comme le progrès, on va voir, on sait que c'est pas la possibilité est là que ça peut être transmis comme ça, mais la recherche nous dit que c'est pas la majorité des cas sont pas transmis comme ça.
Merci, M. Como. Andrew Waugh, Telegraph Journal.
Yeah, hi. My first question is to Dr. Russell. Dr. Russell, I'd just like to get some more information on what this broadening of testing means. Can you tell me specifically how many people are you testing every day right now? If you are planning to test more people, how many more are you going to do every day, and when will that start?
So based on the announcement today, the 811 information has been changed, and so we can test up to 1,000 a day. We have been testing. The range right now in terms of the daily testing has been between 200 and 600 tests a day. And so I think at this point in time, we are opening up the testing criteria, again, because the transmission patterns are changing, and we are concerned about community transmission. So we had been doing some sentinel testing in hospitals and emergency departments. None of those tests came back positive, but I expect that with community transmission, we would expect to see some people in the community with cases of COVID-19 who had not traveled.
Andrew, do you have a follow-up?
I do, thank you, and this one's to the Premier. Premier, we had a couple of Liberal MLAs come out this morning, and while sort of acknowledging everything that the province has done for small business so far, they're asking for more to be done. There's a couple of initiatives there, including, extending the deferment of property taxes and fees until the end of August. Is there going to be anything more for small businesses? And if so, what and when could we expect it?
Well, at this point, we're evaluating the impacts of what we've seen to date. I think we've had about 1,140 businesses connect through the Navigator program. So we've assessed kind of the lay of the land, to speak, of businesses throughout the province. As we look at the economic recovery model for New Brunswick, we have to balance, what are the state of the companies, which ones can get, back up and running to rehire their employees, and how do we best utilize the resources we have. We don't have endless resources here as well. I mean, the federal programs where it backs up the businesses, that's really helpful. But there's, the cost of running government right now, and particularly, what we may experience through the health, the health requirements is very much top of mind. So while we're planning the economic recovery, we're evaluating the current state of businesses. I don't think I can invent new programs here on the fly, and I appreciate, that there's a need for or a reality that opposition members would want to be making suggestions, and I would only suggest that they do that through their leader, and we have an opportunity to discuss these programs, evaluate how they might work in our COVID leadership committee, because that's how we got to kind of function at this time, because it's putting us all together on a common front for a common cause.
Thank you, Mr. Waugh. Simon de l'Acadie Nouvelle.
Oui, bonjour, une question pour le Dr. Russell. Je veux savoir comment est géré l'approvisionnement en masques du personnel de santé. Est-ce qu'on privilégie que le gouvernement s'assure également que les cliniques, les cabinets de médecins, les foyers de soins également reçoivent ces équipements?
J'ai pas compris la question.
Ma question était la suivante, comment est géré l'approvisionnement des masques? Est-ce qu'on privilégie les hôpitaux ou est-ce qu'on donne aussi la priorité aux foyers de soins, aux cliniques, aux cabinets de médecins? Est-ce que tous les établissements de santé reçoivent ces équipements?
Alors maintenant, la manière que la structure pour l'approvisionnement, je m'excuse. Approvisionnement. Pour les masques, c'est avec les régies maintenant, ils ont la capacité de gérer ça et aussi avec l'autre système, avec le département de sécurité publique. Alors, ils ont mis toutes les ressources ensemble. Alors, il y a une manière maintenant pour les distribuer pour les travailleurs de santé qui sont dans la communauté, mais les restants vont être gérés par les régies.
Monsieur Delatte, as-tu un suivi?
Oui, simplement savoir, est-ce qu'on se dirige vers une pénurie ou est-ce qu'on a des stocks suffisants actuellement? Si oui, on peut estimer à combien de jours on dispose de ces équipements-là?
Vous voulez savoir combien de semaines ou jours qu'on aura des masques?
Oui, exactement.
Do we have sufficient stock?
Alors, c'est quelque chose qu'on espère qu'on aura assez au niveau de les commandes que le premier ministre a discuté, qu'on a les ressources des commandes fédérales qu'on a et nos propres montants qu'on a ici aux provinces. Et c'est pour ça qu'on a des directives pour les situations qu'on a besoin de les utiliser absolument. Et les autres cas où c'est la responsabilité du travailleur de santé qui décide le risque. Alors, toutes ces directives-là sont vraiment pour faire certaines que tout le monde connaît les situations où c'est déterminé qu'ils devraient les avoir pour utiliser et qu'ils ont accès.
Merci, Simon. Silas Brown, Global.
Hi, Dr. Russell. You mentioned that obviously the testing criteria is being changed to include basically anybody with symptoms at this point to combat or identify community spread. But I'm curious why make that change now? Obviously, we've had community spread in the province for about a week now. So why at this point make that move?
Well, in terms of prioritization, we expanded the testing in kind of a stepwise direction according to the national strategy and according to case definitions. So that's how it's rolling out in terms of our approach. So again, we've spoken about how the risk used to be for people who had traveled and from certain locations outside of Canada, then certain locations outside of New Brunswick. And so now we know that it can be it's going to be transmitted within the province even if you haven't traveled. And we expanded the testing to make sure that we captured the most vulnerable people in the system. So closed institutional settings, hospitals, nursing homes, etc. So we really wanted to protect those vulnerable populations first. And again, the approach in some provinces, they kind of skipped that level of testing with respect to the general public and anybody who's mildly symptomatic. In some provinces, those people actually are no longer tested and they're just instructed to stay home for 14 days after the onset of symptoms, and they would be followed the same way as a case that was confirmed with a lab test, and public health would follow them up and do the contact tracing exactly the same way. So again, we have been following the national testing strategy as outlined by the Public Health Agency of Canada, and then also taking into account where we are with respect to the transmission type and the number of cases we have, the case definition, and our resources.
Silas, do you have a quick follow-up?
Yeah, when we look at some of those vulnerable populations, particularly people living in and working in long-term care homes are really near the top of the list of those who are quite vulnerable to this. I guess what are the specific measures being done to ensure that people are being protected? Are residents being separated? What sort of measures are happening to protect people as best as possible?
So my understanding at the moment is the staff who work in those areas are being screened and their temperature is taken before they go into work. And my understanding is that if there is any kind of a case that is identified, that they do have a means to isolate them.
Thank you, Silas. Alan Cochran, Times and Transcript.
Yes, thank you. It's a question for Dr. Russell. We're seeing the drive-through assessment centers now, and you're telling people to call 811 first. It's a pretty basic question, but we are getting into allergy season now, and how do people really tell the difference between COVID-19 and the regular flu, a cold, or maybe some other allergies? Some of the symptoms are shared.
That's a great question. So it is challenging, but in terms of the most predominant symptoms, so there is some overlap with symptoms of the flu and any upper respiratory tract infection and COVID-19. So we really look for the fever, which you would not have with allergies, obviously, and the cough. Again, most people with allergies would have burning eyes and runny nose and sneezing and those kinds of things. So we're really predominantly looking, and there's a long list of other symptoms that can be attributed to COVID-19, but the ones we're focused on because we know that in the majority of cases, they have a cough and or fever or both.
Alan, do you have a follow-up?
I guess the shortness of breath would be a major thing as well.
Sorry, yes, that would be, of course.
Thank you, Alan. Adam Huris, Telegraph Journal.
Thank you. Premier Higgs, you raised concerns yesterday about an order of N95 medical masks coming from the U.S. being in limbo. Are you at all urging Ottawa to build a domestic supply so you don't have to rely on the U.S. or other jurisdictions?
Well, yes, and not only in masks, but other kind of health or urgent care needs that we've identified through this process. And I think certainly Ontario are ramping up to build masks and potentially ventilators as well. They've had some facilities there that are well suited to do that. As I mentioned, we've seen clothing that is well suited in Nova Scotia being built. We have sanitizers that's being produced here now in New Brunswick. What I think this brings to the forefront is our country has been vulnerable to this for I guess you could go through many scenarios of how did we get here, but in terms of our dependence on foreign supplies, and then certainly in the recognition what we've seen from the U.S. of basically the willingness that I would like to think wouldn't necessarily be consistent in all cases, but right today being consistent of shutting down our supply, although the good news is that it looks like Canada will receive supplies as ordered. But I think the lesson learned here is let's look at the other risks that our nation has in other sectors. I mean, we've long talked about the energy sector, but this has pulled together our country like I've never seen before. Since I started here only maybe 20 months ago, but or so, when I think of the meetings I've been involved with my colleagues across the country and the conversations we've had with the Prime Minister and the Deputy Prime Minister, I have never seen us pull together with a focus like we have right now. And I just feel like there are other areas of focus that this is the time to say, what about this? Let's decide on what our national strategy should be, because through a crisis, you learn a lot of things, and innovation is always the mother of any crisis where you just have to be innovative. So let's not lose this experience of a national strategy. Let's build on it, and I think we got the foundation here to do that.
Adam, do you have a follow-up?
Yeah, just a short one on ventilators. You addressed it a little bit, but the federal government announced today a plan to build 30,000 in Canada. You talked about the 161 that you have now, the 50% that's on order, and that's enough for now. But are there any projections you have of how many New Brunswick will eventually need?
Not at this time, and I guess as Dr. Russell mentioned that, it's early to project kind of where we would go. At this stage, there's been a lot of modeling done of what the impact of situations like from other countries would have if that same condition arose here in New Brunswick. But I guess what we're hoping to roll out over the coming days, and now with the new pandemic committee together, or task force, it's let's look at the situation in New Brunswick, and let's kind of be able to model and project, as we've seen some other provinces do, on what can be our best case and worst case scenarios, which then leads us into what do we foresee as equipment being provided. I think it's important to recognize that all of this is theoretical in nature, and you have to say, but what if this happens? So the bigger balance for us is ensuring that we have the capability not only to have our own requirements here, but have the capability to reach out and get resources from others. And that's what I see the federal government is doing in collaboration with the other provinces, is that we will have the supplies we need when we need them. I'm feeling more and more comfortable every day about that scenario.
Thank you. Thank you, Adam. Jordan Gill, CBC.
Yes, this question is for the Premier. Premier Higgs, how many dollars worth of tickets have been issued for disobeying the province's emergency measures declaration?
Probably at this point, I mean, as of yesterday, I think 9 or 10 had been issued, so we're talking, maybe a total of $3,500 at this stage. So the average ticket is in the order of $300, a little less. But there has been a lot of communications made, warnings given leading up to that, which have resulted in compliance. So I'm not basing, the number of tickets by necessarily are we forcing people to comply because we're issuing tickets, or are we causing people to comply because they're seeing the need and they want to be part of the solution? And I feel like is a combination. Issuing some tickets, brings it to bear that it's real. We're not joking here. We must do what's necessary to get people's attention. But I'd like to think that generally people are paying attention, and they too want their loved ones to all be here this year.
Jordan, do you have a follow-up?
Yes, I do. Premier Higgs, how many layoffs or job losses have there been in the province so far, and how many applicants for EI have there been?
Well, in our 900 program, the $900, we had about 60,000 at this point that have actually applied. And so we're going through that right now, and they'll be paid out. As we said, the program will end in Thursday, but the reason it ends is because the federal program is up and running. So if that is an indication, I mean, we were originally projecting there would be, in the 30,000 range, but now we've seen 60,000 applicants.
Thank you. Voilà la fin de notre mise à jour. Merci beaucoup. That concludes our update. Thank you very much.
Length of the preceding program, we now join the regularly scheduled program already in progress.
Would he even come here?
Yeah.
And I was curling just before Christmas with Dr. Hayden and Dr. Leonard.
Yes.
And they said, I don't care who you brought here, Darren, you got to bring Matt in, Matt Anderson. And I said, well, how hard would this be? So I went home that night, I looked him up, and he has the same manager that Matt Mays has.
Okay,
so
yeah.
I said,